In this study, the ARIA study, we aim to evaluate the activity of next-generation ALK inhibitors, in this case Brigatinib and Lorlatinib, based on the presence of certain alterations in liquid biopsy, particularly the ALK-resistant mutation. As you know, the ALK-resistant mutations can help us to guide the treatment selection because each ALK inhibitor has a different sensitivity profile to the different ALK resistance mutations, which is the main mechanism of resistance to ALK TKI. However, the next generation ALK inhibitors seems to have the highest sensitivity profile, particularly the third generation ALK inhibitor. So we aim to evaluate this particularly in case of positive ALK resistant mutation in blood, in liquid biopsy, that can be an alternative to the tissue biopsies in this population. So we evaluated a total of 58 patients with ALK-positive non-small cell lung cancer with a liquid biopsy performed before Brigatinib and before Lorlatinib. And we studied this. We included these patients in 9 different centers, including Spain, Germany, France, and UK, and the Netherlands. And so for these patients, we wanted to evaluate all the main outcomes, so overall survival, PFS, response rate, and extracranial and intracranial outcomes according to the presence of 3 molecular events in liquid biopsy: ALK-resistant mutations, single or complex resistant mutations, other mutations, non-ALK, or no detectable mutations in a standard NGS liquid biopsy, homemade or commercial NGS panel. So in these 58 patients, we observed that around almost 30% of the population had ALK-resistant mutations in blood at time of progression. And not only one mutation, the most common was to identify different mutations, and the range was from 1 to 6 different ALK-resistant mutations in the same sample. So the spectrum of mutation was really wide, and also the number of mutations that we can identify. So in the patients, so there were 16 patients with ALK-resistant mutations before this Brigatinib and Lorlatinib, 3 in the case of Brigatinib. So these were the population in both groups heavily pretreated and exposed to at least 1, 2, and even 3 previous ALK TKI. And in the case of Brigatinib, we did not identify responses in these patients, and the outcomes were really poor. In contrast, in the group of Lorlatinib, with 13 patients, we observed interesting PFS and overall survival data and responses up to 50%. So this can be an option. However, when we evaluate the different molecular subgroups, ALK-resistant mutations and also other mutations and non-detectable, we did not identify differences across these molecular subgroups. So in this study, we did not observe activity for Brigatinib, but indeed they are only 3 cases and heavily pretreated, so we need to confirm this in larger cohort. And in the case of Lorlatinib, we identified interesting data. However, we need to also say that this was not, we did not identify differences between the ALK-resistant groups and the other molecular groups. And just to say that they are currently ongoing, the Alkaline study, that is an EORTC study that is exploring particularly this hypothesis, the presence, the activity of Lorlatinib based on ALK resistant mutations, and including the majority of my colleagues working in this cohort. And so we could evaluate our hypothesis and this preliminary data in alkaline trial. Thank you.